if you have low back pain, if you have herniated disc or protruded disc, or if you have numbness or pain in your hip and in your legs, what we call sciatica, you're going to love using the pain therapy system because it's very effective for treating those conditions. Now, first thing you do, let me turn around here, is you put the two big pads on both sides of your back, like this, okay? And then you just turn it on. Let me turn it on first. And then you just turn it up to a point where you actually feel the muscle is contracting and relaxing. And you're going to feel many different types of stimulation, okay? With our device, every few seconds, you actually get a different type of treatment. And that's why it's very effective. Your body never get used to it because it's always constantly changing, all right? So you're going to feel a deep, soothing massage deep inside your back, and that feels really nice. Now, ideally, okay, you should be sitting down, relaxing while you're getting back treatment. But, however, if you must use it while you're standing or walking, you can. This is a portable device, runs on 2 little batteries, so you can take it anywhere, okay? So, but in the ideal situation, okay, you should be sitting down. So let me sit down and show you. Now, you can use this while sitting, driving your car, or while you're working in front of your computer, or just while you're watching television, all right? So that's the best. Let your back relax, put your feet flat on the ground, don't cross your legs, and just feel that deep, soothing relaxation. And you can feel the circulation actually improving and going on as you're getting the treatment. And do it for at least 20 minutes, but if you have more time, do it longer. Frequency-wise, 3 to 5 times a day until you feel you reach a maximum, recovery. And then after that, you can just, use it as you need. Now, if you do have hip pain or numbness running down your leg, I'm going to show you how to treat that, okay? That's relating to a pinched nerve or herniated disc. So we're going to treat that more frequently and in the right position. So let me stand up. Now, let me turn the machine off. So to treat sciatica, okay, we need one pad right in the buttock, all right? Because this is where what we call the piriformis muscle is, and that big nerve, that big sciatic nerve, exits from the hip and runs down your leg. So I'm going to take one pad. So if you have pain or numbness in this side of the hip or your legs, then I'm going to keep one pad on the lower back on the same side. Then I'm going to put the other pad right over the sciatic nerve, which is right in the buttock area, okay? For the man, that's where you put your wallet, okay? Right there, right? So you want to stimulate that. So you just, again, sitting down, turn it on, and turn on until you feel a nice, deep, and also fairly strong stimulation. And you can actually feel the circulation running down your leg. Now, for those of you who have diabetes, if you have diabetic neuropathy, meaning you get numbness, you get pain down your leg, or sometimes you just feel this what we call restless leg syndrome. You in the middle of the night, you just can't sleep because all this weird sensation in your legs and it's very uncomfortable. Or you can use it in the same area, lower back and the hip area. This is very, very powerful, very effective treatment in these 2 locations. Make sure you do this 2 area. Yeah. Now, if your pain and numbness goes all the way down, your leg, if after treating this area alone doesn't get rid of that, in addition to doing this, you can, add the following treatment. So after 20 minutes, this area, if you're still feeling some discomfort, I leave the pad on the buttock, and I take the second pad, and I put it to wherever my problem is. So if my pain and numbness goes to the back of my knees, that's where I'll put the pad. If your pain and numbness go down to your ankle, then I put it right down, to the bottom of the calf. Because what I'm trying to do, I'm trying to stimulate and restore normal circulation. So if you have any circulation problem in your legs, from a disc problem, from tight hip muscles, from diabetic neuropathy, or if you had a stroke, you can do exactly the same treatment because we are going to stimulate the nerve and muscle to restore their function the best we can, okay? So use this regularly and you'll see a big difference. All right. Now let me show you a series of exercises for your back, mostly to improve your movement, flexibility, and some strengthening as well, okay? Most important is to have full movement. So the simple thing to do is just rotate your spine this way. Now lead with your head, So I'm turning my head first to look behind me. And notice my arms. They're very nice and loose to help me swing loosely. And my back, I keep it loose so it can be stretched. So I suggest doing about 20 of them. Okay, and I also suggest you do them first thing in the morning and again before going to bed. This is a very simple exercise you can do at work as well. We sit in front of the computer for a long period of time. Just get up every once in a while to just move and lubricate the back. Okay, now, next one. I'm going to raise my hand. And I'm going to hold my hand together. And take a look at my waist here. I'm stretching the whole side of my body. And I do the other side. You should be feeling stretching on the side of your body. Okay, and again, repeat about 10 times, all right? Now, next one, I'll put my hands together and just put that over my head, and I'm going to extend my back, okay? I make my spine very straight and going up, and then I'm going to rotate. Okay, that should give you some idea. Again, you do about 10 each time. Now, next one I'm going to do, I'm going to be reaching my toes. Okay, so let me bend forward. What I'm going to do is reach the opposite toe. So just going like that. Again, I lead with my head. So I look up to the ceiling as I reach down. So I get my whole spine to rotate. And I can adjust the stretching by adjusting the width of my stand. Okay? Look up to the ceiling and bring your hand way back. Good. Now, another thing I do, just going to be reaching to the ground. So I reach forward. I reach right below me and then behind me. Okay, so 1, 2, 3. 1, 2, 3. 1, 2, 3. Now, if you can't go all the way, don't worry, okay? But you should be keeping your legs fairly straight. So 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay? Now next thing, I'll reach to the side. So 1, 2, 3. And the other side. 1, 2, 3. So let me turn so you can see better. Okay? So 1, 2, 3. 1, 2, 3. Okay? Good. Now when you get up, you should bend your knees and then get up this way. Then your head won't feel lightheaded. Let me show you. So anytime you're bending down, don't get up right away. Bend your knee forward, and then get up this way. That way you won't get lightheaded. All right. Now, other stretches have to be done on the floor. So let me go down to the floor and show you. A simple one is we cross our legs this way. Then, using the arm as an anchor, I'm going to be pushing my arm this way. So I'm going to push against my leg, and the other hand, I gently push, and the idea here is to rotate your lower back. So I can feel the stretching going on in my lower back right now, see? That feels good. Hold for a few seconds, release. Do the other side, so cross the leg first, cross the arm, anchor against the leg, push with this hand, and feel the stretch. Let the back go loose and just feel the stretching. Feels good. And release. So side to side. Stretching, release. Stretching, release. Okay? Again, you can repeat 10 times on each side. Now, I'm going to turn here, show you another stretch. Now this one, I want you to pull your knee towards the opposite shoulder. So pull the right knee to the left shoulder. So using my left hand, I'm going to pull my knee up and then across. And notice I'm keeping my shoulders flat on the ground. So my shoulder blades are touching. I'm just pulling my knee up and across. So pull up and across. Keep the shoulder blades down and feel the stretching, a light stretch in the hip and lower back. Okay? This you can do in bed. Okay? It's just a very gentle stretch just to get you going in the morning. Good. Now next stretch, I'm going to bring both knees to my chest. I'm going to just gently pump it up so that I can lift the base of my back off the ground. See? Just like that. So pull it up towards your chest. Notice my head and my shoulders stays on the ground. If I do this, I'd be straining my neck, and that's not good. So keep your head down and just pull. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so feel a nice stretch in the base here. Okay, now while you're in this position, you can do some sit-ups to strengthen your abs and your back muscle. Now, if you have back problems, you should do what I call rocking chair sit-ups, because that will not put any strain on your neck and will not put any strain on your lower back. So what you do is keep your back curved like the bottom of a rocking chair, and then rock yourself up like this. Okay, so the first step, let me explain. You bring your knee to your chest first, and then you rock up. Okay, so knee to chest first, and then rock up, just like that. See? So 1, 2, 3, 4, 5. Okay? So that's a common way. Now, if you're not strong enough to do it that way, then you can use your hand to give you some momentum to help you get up easier. So again, knee to chest first, but this time I'm going to use my hand to help me get up easier. Okay, so, and you see my back? I keep it nice and curved, just like the bottom of a rocking chair. Okay? Okay, so again, breathe out. So 1, 2, 3, 4, 5. Okay, so that's good for strengthening your abs and your lower back. Now, I'm going to go show you the next stretch. Next one, you have to lie face down. Now, for this stretch, we want to extend the back slightly. So if you have back pain, and if you're doing this one, if it does cause you more back pain, then don't do it or do less. Okay, you have to kind of feel it, see if this one is good for you or not. So you can do it very gently. Just go up on your elbow, okay, and slightly and slowly lift your head up while extending your spine. And you should feel the lower back being stretched. Okay, once you feel that release, you can now go on your hand and just gently push up. Now, extend the back. And you can just gently rock it to loosen up further. And tilt your head back and just relax. feel the back being relaxed and being stretched. And just hold it for about 10 seconds. That's all you need. And then just relax. And just repeat that 2 or 3 times, and that should be adequate. All right. Now, for the next exercise, okay, this one's a little bit more difficult. This one's specifically to stretch the, what we call the gluteus and piriformis muscle of the hip. This one's very important for anyone who gets numbness or pain in the legs or for chronic back problem, okay, because we're going to stretch the back muscle as well as the hip muscle. Okay, so get into this position, and the leg you want to stretch goes underneath you. Okay, so I bend the knee on my left hip, that's what I want to stretch. I put underneath me, and then I'm going to bring my chest straight down. Now, I'm going to keep the opposite shoulder, this time it's my left shoulder, up, and my right shoulder down, so I can feel the pressure and the stretch on my left hip. That's a really good and strong stretch. Okay, just hold that position for about 10 seconds. And then switch side. So this time, I'm going to stretch my right hip and lower back. So I bring my right leg underneath me. My contact surface is on the outside of my leg. So it goes straight down. And then I put the opposite shoulder down towards the floor while keeping the shoulder on the same side up. So you can really feel it. Okay. Now let me just change position so you can see it better from a different angle. So if I want to stretch my right hip, I would bend my right leg and put it underneath me. Okay. I go straight down. I put the opposite shoulder, which is my left shoulder, down while holding the right one up. And feel the stretch in this whole buttock, hip, and back area. Okay. To stretch the left side, I bring the left leg underneath me. I bring my chest down, and I bring the opposite shoulder, which is my right shoulder, down. That gives you a really nice stretch in this whole area here. Okay? So that's a really good stretch for anyone with hip pain, sciatic nerve pain, and low back pain. Now, for the next exercise, very simple. We're going to reach and touch the opposite toe. So, just sitting down, keeping your legs fairly straight, and then just reach forward. Now, if you can't touch your toes, it's okay. Just go as far as you can. It's the motion, and eventually, you'll be able to reach further and further. The key is to do it every day, and then you'll see better improvement over time. Okay, just like that. And then another simple stretch, just sit like that, leg in a V shape. Just hold your leg with your hand, use that as leverage, and just gently pull. So you feel it stretching. Okay, just pull your chest towards the ground. Just like that. Okay, again, those all help with different angles and different muscle groups of your back. Another one you can do is just bring your feet together, hold your feet, and just gently, okay, relax the adductor or the inner hip muscles. The goal here is to stretch and loosen up all the muscle around your hip and your lower back, because if you have good movement, your joints will move better, your muscle will stay more loose, and that's how you stay healthy. Now, one other one you can do is stretch the hip muscle. Is bring the knee like this and bring it towards you. See? Just bend the hip and pull it towards you. Like that. Turn over to the other side. See? Just like that. Okay. So those are some of the basic stretching exercises for your back. And if you do them regularly, it's going to help you a lot. I do suggest that you use my decompression belt, my muscle therapy system, and some of the other supplementation that we have to help you regain your health and to stay healthy. Good luck with your health and best wishes to you. Now, if you have shoulder pain from tendonitis, bursitis, or arthritis, you should be doing this treatment. Use the large flextone pads in 2 areas to start with. We're going to put one in front. And then one in the back of the shoulder. All right? And we just turn it on. And it doesn't really matter which mode you use. I personally like mode A and B, the best for this area. And the key here is you want the arm to be fully relaxed. In fact, when you're treating any body parts, you should be fully relaxed in a neutral position. You don't want to fight against the machine, all right? You want it to be nice and relaxed so the pain therapy stimulation can help to work the knots out to reduce the inflammation, to stimulate circulation, okay? You can only do that if you're nice and relaxed. So I usually like to get a cushion and rest my arm like this so that the shoulder can be totally relaxed when I'm doing this treatment. Now, you see the muscle moving, and that feels really nice, okay? It feels like the knot inside is getting worked out. If any pain inside, it's going to help to, reduce the pain, improve the circulation, reduce the inflammation, and more importantly, help to break up any scar tissue that you may have developed. So some of you may have trouble, raising your arm, like what we call frozen shoulder problems. Then you got to do this to break up the scar tissue. Now, if you have a chronic problem in your shoulder, elbow, wrist, hand, like numbness and loss of sensation in your arm, and using the stimulation in those areas alone may not be enough. You also need to stimulate and treat your neck with my pain therapy system, because if there's problem in your neck, you may not have neck pain, but it can cause entrapment or pinching of the nerve that starts from your neck, that runs through your shoulder and through your arm to your fingers. So in order for you to get the best results, for any chronic problem, I suggest you also treat your neck, which I'll show you in the next segment, okay? And also the local area where you're having pain. Now, let me continue with the rotator cuff area here, okay? So after 20 minutes with the pads in front and behind, I usually like to stimulate another set of points. Now, a lot of the points I'm showing you are relating to the acupressure or acupuncture points, which I learned, from my studies. And by stimulating the nerve and the points, we're going to get really good results. Combined with the new technology we have, okay, inside our pain therapy system, and if you're using it now, okay, there's many, many different types of treatment programmed to this device. And because it's constantly changing, okay, our proprietary technology allow your body to get better faster because it will not adapt to it. And that's why, you get such great results even after 20 minutes of use, okay? Now, with any injury that are chronic or acute, do not be afraid to use it, frequently, okay? You can use this 3, 4, 5 times a day. Whenever you have a chance to sit down and relax, just do it, okay? Because that'll speed up your recovery. I know before my practice, people can only come to my practice, to see me maybe 3 times a week maximum. And they don't heal very fast because they're not getting enough treatment. Well, with this home therapy device that's portable, you can get as many treatment as you need and whenever you need it. And that's why, this is getting such incredible response with so many people with different problems. So do that and you'll get better faster. Now, here's a good exercise for your shoulders. If you have bursitis, tendonitis, arthritis in your shoulder joint, or if you have trouble lifting your arm up all the way, then you should try this exercise. It can help to just break up some of the scar tissues inside to increase the range of motion. So first thing you do is just hold your arm up as high as you can, okay? Make a fist and whip the arm down as fast as you can and then let it go completely loose so that the momentum brings the arm back up. So whip it down fast and let the momentum bring it back up. So like this. Now you don't have to stop at the top. I'm just stopping so you can see. You can do it continuously. Come down fast, let the momentum bring it back up. Now, do not use your muscle to lift it because you won't be able to, okay? It's the momentum that brings it up and then that breaks up some of the scar tissue. So let me show you again. So bring it down hard and fast and let it go completely loose and let it go around. Okay, so do about 10 times in one direction and repeat in the opposite direction. Again, I start with the arm up as high as I can. I'm going to bring it down hard, let it go loose, let the momentum carry around. So here we go. Okay, just like that. And you'll find it'll start to get more loose each day as you do this. All right? Keep doing it until you get your full range of motion back. Now here's some other stretching exercises you can do for your shoulder. Okay? One is, if you want to stretch the back of the shoulder, just bring your arm out, anchor with the other arm, and just pull. Okay? You should be feeling the stretching back here. Now once you feel the pull, you can rotate your body slightly to get additional stretch. Just like that. Okay? Now you can hold for 10 seconds, or you can just gently tug on it to get that stretching effect. All right? Another stretch is just bring your arm up, bend at the elbow, and grab the elbow with the other hand and pull down till you feel the stretching happening in this area. Okay? And to get additional stretch, just bend this way. And then now you can feel it stretching all the way down to the side of your body as well. So that's a nice stretch. And then if you want additional stretching, just rotate it this way. Okay? Now some of you may have trouble turning your arm. So we want to increase the range of motion there. So to do that, bring your arm out, turn your palm up, and go back. And then when you come back in, turn your palm down, and go across. So, now bring it all the way back till you feel the stretching action in the shoulder and in part of the chest muscle. So, palm up on the way back, palm down on the way back. Okay, so those are the basic stretching exercises you can do for your shoulder. I suggest you do each exercise about 10 repetitions each time and just repeat it throughout the day, 2-3 times a day, or as you feel you need it. The key is to do it every day because that way you can restore any movement that you have lost and also maintain any good movement that you do have, and then you can stay healthy all the time. Now, if you have pain in your elbow right here, okay, what we call lateral epicondylitis, okay, you're probably doing some heavy work with gripping, or you actually play some sports, or you could have a circulatory problem or pinched nerve problem from your neck that supply this muscle group. Now to treat this, okay, what we're going to do is we use the large flex tone pads, and we're going to place one right over the painful area. And then the second one, we're going to just place it below. Our goal here is to relax what we call the extensor muscle of the forearm, and to reduce the pain here, and to reduce the inflammation, to stimulate the circulation overall, to allow the body to heal itself. All right? So if I stimulate my muscle this way, it's going to speed up recovery. Now before we do that, anytime you stimulate any body parts, that body part should be fully relaxed in a neutral position. You don't want to be holding your arm up while you stimulate, because now you're fighting against the machine, and that's not good. So get a cushion, okay? Make sure your arm's nice and relaxed. We just turn it on. All right? And doesn't matter which mode you use, but you want to have it high enough, the intensity high enough that you actually get some muscle contraction and relaxation. All right? So I also suggest, you know, you trying to rest the arm and not to do the repetitive motion as much, so they have a chance to heal properly. And also, you should try, you know, treating your neck. If this is an ongoing problem that you had for years and years, and not a recent injury from just doing something, you know, that's too straining for your body, you definitely should be treating your neck. You just go to the section on DVD where I teach you how to treat neck and headache, and you'll learn how to treat the neck. Because I've seen in my practice many times people who get pain here and they don't even do hard work. Okay, they get numbness and weird sensation in the arm, or they get what we call carpal tunnel syndrome, where their hands go numb and they lose control. It all comes from the neck. So do not ignore the neck. This is where the blood and nerve starts, and it circulates down your arm. And you need the blood and the nerve to circulate 100% in order for your body to function right, so that it can repair itself. So if you don't treat here, then it's very hard to get 100% result by treating the painful area alone. Okay, so just to remind you of that. Now, you feel pain on the other side of the elbow, right here. Okay, actually here we call it, you know, tennis elbow, whether you play tennis or not. And on this side we call golfer's elbow. Okay, again, whether you play golf or not. So here we do the same thing, except now we put the pads over this painful part of the area, and on this part of the muscle group, the flexor group. And this is also very good for anybody who get that numbness and tingling down their arm into the fingers, you know, the carpal tunnel syndrome group. So we just turn that on. And here, just turn up slowly, because there is a nerve that runs through here and here. So it's quite a sensitive area. So just go slow. In fact, anytime you're using the machine, turn up slowly, because a lot of you might misjudge my machine by its size. You go, wow, so small. You know, I'm not going to worry about, you know, it having too much power. But I can tell you, this is one of the most effective and most powerful device on the market today anywhere. All right. So just like that. Okay. Make sure your arms relax. Just let it do its work. Okay. Let it relax the muscle, stimulate the circulation, and then your body will heal on its own. If you have elbow pain right here, then you need to stretch out this group of extensor muscles. To do that, just grab your palm, pull your wrist towards you while you're straightening out the elbow, just like this. Okay? You can hold it for a few seconds and repeat it about 10 times, just like that. All right? Now, if you have pain on the inside of your elbow, right here, then you need to stretch out the flexor group of muscle. And to do that, you have your palm face away from you, and again, I'm pulling the wrist, so I'm pulling the hand towards me while I'm straightening out the elbow. I can hold it for a few seconds to give it some more stretching, and repeat about 10 times, or whenever you feel you need to. All right? This is important for anyone who do a lot of computer work. If you do a lot of heavy labor work with your hand or gripping action, then those muscles can tense up. Or if you play, certain racket sports, again, they can give you trouble. So do those exercises regularly can help to maintain, the length of those muscles, so it doesn't pull on this, so the attachment of the tendon doesn't pull on the bone, so you stop getting those problems coming back. Now, if you have a wrist problem, okay, if you had a fracture before, you got some arthritis in there, and you lack motion in that wrist, the best thing to do is to flap that wrist loosely, okay, just like that. In fact, let the arm down all the way, okay, and just flap it whenever you have a chance, okay. Just do that as often as you can throughout the day, and that can help to restore the motion in that wrist joint. Now, if you have trouble turning your forearm, okay, there's two bones here, and they cross over each other, and sometime after a fracture with the casting effect, you get a lot of scar tissue, so you cannot turn your hand. Well, don't give up. just repeat, okay? Lots of repetition. Just turn and give it a little snap at the end, you know, like try to use the momentum to get motion. So again, let the arm go loose completely. Just turn, 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 turn. So whichever direction you have restriction, and usually it's going out, then I would do that repeatedly throughout the day, and that will help you restore the motion that you have lost. Now, for any finger joints that you may have arthritis or other problem that cause loss of movement, then throughout the day, again, you can just slowly traction those joints, just like that. So whichever joint gives you trouble, just pull on it and move it passively, just like that. Okay, and take it to the range of motion and just gently stretch it, each joint just like that. Okay, so again, any joint you have problem, just move it. There's an old saying, motion is lotion. So when you move a joint that's stiff, you can help to lubricate the joint so that you can restore some of the motion you have lost, and also to maintain what you have. I mean, maintaining good range of motion throughout the body is very important to stay active and to stay healthy. Now, if you have what we call carpal tunnel syndrome, where you're having numbness in your hand, okay, especially the thumb and index finger, and you're losing control, the coordination and the strength in your hand, that means you have a pinched nerve going down to your hand. So that problem can be coming from the wrist, but I can tell you from my practice, that a lot of people who's been diagnosed with carpal tunnel syndrome do not just have problem with the wrist. In fact, the majority of them have problem with the neck. So if you have any problem with your hand, like numbness, loss of power, loss of coordination and strength, make sure you treat your neck. That's the most important area, more important than your wrist. Okay. Now you could treat your wrist, but I've found many people in my practice, many of my patients, I just look after the neck and we restore the function there, and the hand and wrist works fine after that. Okay. So to treat the wrist, if you have pain from arthritis or chronic sprain, or if you have fractured your wrist from a fall, you get a lot of scarring and restriction movement, then this treatment is very good. So to treat the wrist, okay, we just use the 2 large pads. Now the important thing here to remember is because the pads are pretty big, we don't want the pads to be touching against each other. If the pads make contact against each other, then the current will go between the pads instead of going through your body. So it will not work in that sense. So make sure the pads are not touching each other. Now anytime you're treating any area, make sure that body part is nice and relaxed, okay? So that you're not, you don't have to flex your muscle. Let it relax, put it in a neutral position. So I always use a cushion here and just stimulate it. Now go slow here because there is a nerve here called the median nerve that runs through your wrist, okay, between the 2 tendons, and it's very sensitive. So you're gonna feel stimulation going right down into your fingers. Okay, I just go slow. There it is, okay? So you're gonna feel the muscle contracting and feel the sensation, the circulation going to your fingers. And it's a very nice feeling as long as you go slowly with the device in turning up the intensity. Just like that, okay? So 1 pad on each side, and you can see my hand, is contracting because the muscles is working and the nerve is being stimulated. And that's what you do, okay? 20 minutes at a time, 3-4 times a day until you feel better. Now, if you have arthritis in your fingers, okay, any of your fingers, from osteoarthritis, if you have rheumatoid arthritis, that's very nasty, all swollen up and loss of mobility, okay? If you don't use this, that's great, because I've seen many patients who use this and they've been able to reduce the anti-inflammatory and the painkillers they have to take, which is very hard on your body. So you can use this to reduce your meds, or some of my patients actually don't need meds anymore. But before you change any of your medication intake, consult your own physician, please. All right. So to treat any of the fingers, you just sandwich. Very simple. Just sandwich your joints with the pads. Okay. If you play ball, sports, and you sprain your fingers, just do this all day long. That's the best way to stimulate the circulation and the self-healing. okay, just like that, all right? By doing this, I'm gonna reduce the inflammation, reduce the pain. Now, if you have arthritis anywhere in your body, go to our website too, because we have a lot of good supplements that are very good for, joint inflammation or cartilage problems. Just like that, all right? Best wishes to you. If you have elbow pain right here, then you need to stretch out this group of extensor muscles. To do that, just grab your palm, pull your wrist towards you while you're straightening out the elbow, just like this. Okay? You can hold it for a few seconds and repeat it about 10 times, just like that. All right? Now, if you have pain on the inside of your elbow, right here, then you need to stretch out the flexor group of muscle. And to do that, you have your palm face away from you, and again, I'm pulling the wrist, so I'm pulling the hand towards me while I'm straightening out the elbow. I can hold it for a few seconds to give it some more stretching, and repeat about 10 times, or whenever you feel you need to. All right? This is important for anyone who do a lot of computer work. If you do a lot of heavy labor work with your hand or gripping action, then those muscles can tense up. Or if you play certain racket sports, again, they can give you trouble. So do those exercises regularly, can help to maintain the length of those muscles so it doesn't pull on this, so the attachment of the tendon doesn't pull on the bone, so you stop getting those problems coming back. Now, if you have a wrist problem, okay, if you had a fracture before, you got some arthritis in there, and you lack motion in that wrist, the best thing to do is to flap that wrist loosely, okay, just like that. In fact, let the arm down all the way, okay, and just flap it whenever you have a chance, okay. Just do that as often as you can throughout the day, and that can help to restore the motion in that wrist joint. Now, if you have trouble turning your forearm, okay, there's two bones here, and they cross over each other, and sometime after a fracture with the casting effect, you get a lot of scar tissue, so you cannot turn your hand. Well, don't give up. Just repeat, okay? Lots of repetition. Just turn and give it a little snap at the end, like try to use some momentum to get motion. So again, let the arm go loose completely. Just turn, 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 turn. So whichever direction you have restriction, and usually it's going out, then I would do that repeatedly throughout the day, and that will help you restore the motion that you have lost. Now, for any finger joints that you may have arthritis or other problem that cause loss of movement, then throughout the day, again, you can just slowly traction those joints, just like that. So whichever joint gives you trouble, just pull on it and move it passively, just like that. Okay, and take it to the range of motion and just gently stretch it, each joint just like that. Okay, so again, any joint you have problem, just move it. There's an old saying, motion is lotion. So when you move a joint that's stiff, you can help to lubricate the joint so that you can restore some of the motion you have lost, and also to maintain what you have. I mean, maintaining good range of motion throughout the body is very important to stay active and to stay healthy. Now, if treating the abdominal area does not get rid of all your menstrual cramps, you need to also treat the lower back area. So put one pad on each side of your lower back. You can just go to treatment of low back pain section in DVD. But basically, one pad here, one pad on this side. And the reason we want to stimulate the back is the nerve that supplies the back muscle also have connection to the nerve that stimulates the uterus. So by stimulating the back muscle, I can help to normalize the nerve and muscle function in both the back and in the uterus area. Okay, so you can do that in addition for your menstrual cramps, and you'll find really good results.